the nursing officers of labor home covered the following 10 important topics thoroughly. Now it's time to display for refreshing and recollecting. The topics are the 10 policies of baby-friendly hospital initiative, the 10 steps for successful breastfeeding, kangaroo mother care, standards and verification criteria for respectful maternity care, birth companion during childbirth, counseling the birth companion, patients' rights, areas catered to emergency services in CLR, SLR, eclampsia and postnatal recovery and emergency OT. Janani Suraksha Yojana, that is JSY, Janani Sishu Suraksha Karyakram with JSSY. That's it. Thank you.
Our hospital, Rajive Gandhi Women and Child Health Hospital, is a baby-friendly hospital. We are following the 10 policies of BFHI or following. Number 1. Our hospital has an official policy to protect, promote and support breastfeeding. All maternity and childcare health staff in the hospital receive training in the skill to promote breastfeeding. All mothers, both antenatal and postnatal, are informed about the advantages and benefits of breastfeeding. We assist mothers in the early initiation of breastfeeding within half an hour of birth for a normal delivery, within 4 hours of birth after a cesarean section. All mothers are shown how to breastfeed and how to maintain lactation, even they should be temporarily separated from their infants. We give newborn no food or drink other than breast milk. Infant foods and breast milk substitutes are strictly prohibited in this institution. We practice rooming in by allowing the mothers and babies to remain together 24 hours a day. We encourage all mothers to breastfeed on demand. We strictly prohibit the use of artificial teats, pacifiers, soothers and feeding bottles. We provide follow-up support to mothers for exclusive breastfeeding up to 4 to 6 months and after birth and continued up to 2 years of age. We enlist the cooperation of visiting family members to support breastfeeding mothers. Mothers are also advised on whom to contact for assistance in overcoming any problems in breastfeeding. Thank you.
Women and Child Welfare Hospital is a baby-friendly hospital. In our hospital, we are following the 10 policies of BFHI. Those are as follows. Number 1. Our hospital has an official policy to protect, promote and support breastfeeding. Number 2. All maternity and childcare health workers receive training in the skill to promote breastfeeding. Number 3. All the antenatal and postnatal mothers are informed about the benefits of breastfeeding. Number 4. We assist mothers in the early initiation of breastfeeding, that is within half an hour for a normal delivery and within 4 hours for a cesarean section. Number 5. All mothers are shown how to breastfeed and how to maintain lactation even if they are temporarily separated from their infants. Number 6. We give newborns no food or no drink other than breast milk. Infant food and breast milk substitutes are prohibited in this institution. Number 7. We practice grooming in technique by allowing the mothers and babies to remain together 24 hours a day. Number 8. We encourage all mothers to breastfeed on demand, that is by knowing the infant feeding cues. Number 9. We strictly prohibit the use of artificial teats, pacifiers, soothers, dummies and feeding bottles. Number 10. We provide follow-up and support to mothers for exclusive breastfeeding for 4 to 6 months after birth and continued breastfeeding up to 2 years of age. We also enlist the cooperation of visiting family members for breastfeeding mothers. The last one is we also advise the mothers to contact the support groups in case of any problem in giving breastfeeding. Thank you.
10 steps to successful breastfeeding. Have a written breastfeeding policy that is routinely communicated all healthcare staff. Train all healthcare staff in Skills necessary to implement this policy. Inform all pregnant women about the benefits and management of breastfeeding. Help mothers initiate breastfeeding within half an hour of birth. Show mothers how to breastfeed and how to maintain lactation even if they should be separated from their infants. Give newborn infants no food or drink other than breast milk unless medically indicated. Practice rooming, that is allow mothers and infants to remain together 24 hours a day. Encourage breastfeeding and demand. Give no artificial teats or pacifier to breastfeeding infants. Foster the establishment of breastfeeding support groups and refer mothers to them on discharge from the hospital or clinic.
Good morning. Now I am going to tell about the 10 successful steps to breastfeeding. Number 1. Have a written breastfeeding policy that is communicated to all healthcare staffs. Number 2. Train all healthcare staff in skills that is necessary to implement this policy. Number 3. Inform all pregnant women about the benefits and managements of breastfeeding. Number 4. Help mothers to initiate breastfeeding within half an hour of birth. Number 5. Show mothers how to breastfeed and how to maintain lactation even if they are separated from their infants. Number 6. Give newborn infants no food or drink other than breast milk unless medically indicated. Number 7. Practice rooming in, that is, allow mother and infant together 24 hours a day. Number 8. Encourage breastfeeding on demand. Number 9. Give no artificial teats or pacifier to breastfeeding infants. Number 10. Foster the establishment of breastfeeding support group to mothers and refer mothers to them on discharge from the hospital. Thank you.
Kangaroo mother care. Kangaroo mother care is the skin-to-skin contact between the baby and the mother's chest. It provides warmth, prevents apnea and stimulates breathing. Position of KMC. Mother should be in a sitting or semi-reclined position while providing KMC. KMC can be provided anywhere. It is to be provided as long as possible. All stable low birth weight babies are eligible for KMC. In hospitals, KMC is provided in nurseries and postnatal wards. And KMC should be continued at home and can be provided as long as possible. The components of KMC are skin-to-skin contact between the mother's chest and the infant and exclusive breastfeeding. The prerequisites of KMC are support to the mother and post-discharge follow-up. The benefits of KMC are it provides warmth to the baby, promotes growth and weight gain, it reduces the hospital stay, it reduces infection, it promotes baby-mother bonding. KMC is simple, low cost effective and highly effective intervention which benefits low birth weight babies. I am going to explain about the 7 standards and verification criteria that have been given by our USAID and NMCHIP. The 7 standards of respective maternal care are: first one, the woman is protected from physical harm, ill treatment. Never use physical force, abrasive behavior, never hit the patient, never physically restrain the patient. And the second point is the women right to information, informed consent and choice birth preferences given. We should self-information about ourselves to the patient and the birth companion. Always get the consent before any procedures and give the choice of position for the patient during delivery. The third point is confidentiality and privacy is given to the patient. Never share the patient information with anyone. The files are protected in our locker and use screen or any curtains to protect the patient during any examination. The fourth point is the woman is treated with dignity and respect. Speak politely to the patient and the birth companion. The fifth point is the woman is given equitable care. Always speak to the patient in a language, simple language that is understandable by her and give equal care to everyone. And the sixth point is the woman is never left without care. The women should not be unattended or never left alone and come quickly here to her call at any need. And the seventh point is the women is never detained or confined against will. Our facility never detains or confines the patient who doesn't pay. These are the 7 standards that are followed by our hospital. Thank you.
Now I am going to tell about who is a birth companion, protocols of a birth companion and her responsibilities. Now we can see who is a birth companion. A birth companion is one who gives continuous one-to-one support to women experiencing labor and childbirth. Now we can see who can be a birth companion. Any female, preferably a relative of a patient, can be a birth companion who has experienced labor. The female of a pregnant woman can be allowed as a birth companion if she is in an institution providing privacy. Next, protocols of birth companion. The birth companion should maintain personal hygiene. The birth companion should not interfere in any work of the medical staffs. The birth companion should be free from communicable disease. Responsibilities of a birth companion. The birth companion should comfort and reassure the patient. She should encourage the patient to take deep breath in between contractions. She should help her to find a comfortable position and change position if needed. Birth companion should encourage the patient to walk in between contractions. The birth companion should give adequate fluids to the patient. Help the patient to use restroom frequently. The birth companion should tell the patient about the progress of labor. She should help her in care of newborn. She should help her to assist early breastfeeding. Next, the birth companion should be informed to call for help immediately if danger signs she observes.
In labor room, counseling the birth companion. Danger signs of mother, danger signs of baby and counseling advice. Danger signs of mother. Excessive bleeding, severe abdominal pain, difficulty in breathing, severe headache or burning vision, urge to push, cannot empty the bladder every 2 hours, fever or chills, foul smelling and vaginal discharge. Now come under the danger signs of baby. Fast difficulty in breathing, fever, unusually cold, stop feeding well, less activity than normal, whole body becomes yellow. Now come under the counseling advice. Support with cope up with the labor pain, no bath, oil for baby, initiate the breastfeeding within half an hour, clothe and wrap the baby. Thank you.
Good morning. In our hospital, we have some patients' rights. There are some 10 rights. First one, right to receive quality medical care, right to be treated with dignity and respect, right to privacy and confidentiality without any discrimination, right to health information regarding diagnosis, treatment and investigations, right to access clinical records, right to continue care, personal safety and security, right to follow spiritual belief, right to complain and redressal of grievance, right to refuse treatment. Thank you.
Good morning. In our hospital, we are following 10 patient rights. They are right to receive quality medical care, right to be treated with dignity and respect, right to provide privacy and confidentiality without any discrimination, right to get health information regarding diagnosis, investigation and treatment, right to access clinical record, right to provide continuous care, right to personal safety and security, right to follow spiritual belief, right to complaint and redressal of grievances, right to refuse treatment. Thank you.
Good morning to all. I am going to present the topic on JSY and JSSK. We can see one by one. JSY. JSY means Janani Suraksha Yojana. This scheme was launched on 12th April 2005. This scheme is applicable for one who deliver live birth at government institution and recognized private institution. Beneficiaries below poverty line, BPL groups, SC and ST. Necessary document needed: photocopy of Aadhaar card, ration card, a bank account book, first page, discharge slip, antenatal yellow trace card, marriage certificate if they are not having ration card. The above copies should be attached with the JSY application form and filled by them and should be submitted to family planning office. Then we can see JSSK scheme. What is meant by JSSK? Janani Sisu Suraksha Karyagram. This scheme was launched on 1st June 2011. Purposes to provide free special health care to all mothers and newborn babies. Special features for mother: free cashless normal delivery and cesarean section, free investigation, diagnosis and treatment up to 1 year after delivery, free diet 3 days for normal delivery, 7 days for cesarean section, free transport from home to institution to home, free drug and consumable, free blood transfusion, free transport between facilities to in between facilities. In case of referral, an amount of 500 rupees will be deposited to all mothers to their bank account. This is only Pondicherry residence mothers, instead of free transport. For babies, free investigation, treatment and diagnosis up to 1 year after delivery, free blood transfusion, free transport from home to institution and institution to home. Thank you.